Hello, I'm Yoshiaki Ando from Osaka International Cancer Institute, Japan. I'm the first author of the paper Long-Term Outcomes After Endoscopic Resection for Cervical Esophageal Squamous Cell Carcinoma. First, I'd like to appreciate editors of GIE for giving me the opportunity to discuss about our study. Cervical esophageal cancer is rare, accounting for only about 5% of all esophageal cancers. It's often diagnosed at an advanced stage, and only about 10% of cases are treated with endoscopic resection. Several reports have described short-term outcomes showing the technical feasibility of endoscopic resection. However, there have been very limited data on the risk of metastasis or long-term survival, especially for cervical esophageal cancer. Most previous evidence comes from thoracic esophagus, and it has been unclear whether the same result applies to cervical regions. In particular, the role of additional chemoradiotherapy after endoscopic resection has been studied only in thoracic regions. Therefore, in this study, we investigated the long-term outcomes of endoscopic resection for cervical esophageal cancer, stratified by tumor invasion dips and lymphovascular invasion. This was a single-center retrospective study. We included consecutive patients who underwent endoscopic resection for superficial cervical esophageal squamous cell carcinoma between 2010 and 2022. Pathological evaluation was based on the Japanese classification of esophageal cancer. We divided patients into three groups according to invasion depth and lymphovascular invasion. Group A, EP or LPM, without lymphovascular invasion. Group B, MM without lymphovascular invasion. Group C, MM with lymphovascular invasion, or SM1, SM2. The primary outcomes were overall survival, disease-specific survival, and recurrence-free survival. Result. In total, we analyzed 131 patients. The median follow-up period was 64 months. By group, the results were as follows. Group A, 103 patients. 86 achieved R0 resection, and the remaining 17 did not receive additional treatment. No recurrences or cancer-related deaths occurred. Group B, 10 patients. No additional treatment was performed. No recurrence or deaths were observed. Group C, 18 patients. 14 patients received additional chemoradiotherapy, 2 patients developed metastatic recurrence, and 1 patient died of the disease. At 5 years, survival outcomes were as follows. Overall survival, 90% in Group A, 100% in Group B, and 75% in Group C. Disease-specific survival, 100%, 100%, and 92%. Recurrence-free survival, 90%, 100%, and 69%. There were significant difference in disease-specific survival and recurrence-free survival. What do these findings suggest? For EPO-LPN without lymphovascular invasion, long-term outcomes are excellent, and treatment strategies similar to thoracic esophageal cancer are appropriate. For MM without lymphovascular invasion, outcomes were favorable without additional treatment. But because of the small sample size, careful long-term surveillance is still required. For lesions with lymphovascular invasion or submucosal invasion, the risk of metastasis is clearly high, and endoscopic resection alone is insufficient. However, since surgery for cervical esophageal cancer is highly invasive, endoscopic resection followed by chemoradiotherapy appear to be a more practical treatment option. Because the number of high-risk cases remain small, further accumulation of cases and studies are needed to establish optimal treatment strategies. Thank you for your time and attention. If you have any question, please don't hesitate to contact us. Thank you.